Next question, is the incidence of Lyme disease and tick-borne infections on the rise? And if so, why? Well, here's the challenge. Is it on the rise, or is it just not reported? The best way, there's a joke that I remember from the Indian Ministry of Health, and when the minister was asked how many cases of malaria are there in this region, his answer is none. Because if he reported there was lots of cases of malaria, he'd be fired. So the challenge then with Lyme disease is that it's underreported. You can't depend upon the antibody test because the antibody test underrepresents the total number of cases. In Ireland, the only reporting for Lyme disease is Lyme neuroborreliosis, and if you meet a strict criteria. So maybe there's thousands of cases in Ireland, of which 30% have a rash, of which a certain percentage of those get a blood test done, but only a dozen end up coming to the hospital sick with disseminated Lyme that's gone to the brain. And then if you get a lumbar puncture done, you are then given a diagnosis of Lyme neuroborreliosis if you fit certain specific criteria. But this is the tip of the iceberg. So modelers in Ireland have said no, even though there's only 20 cases of Lyme neuroborreliosis reported annually in Ireland, and the government generously says maybe there's 200 cases. The reality is that based on patient reporting, patients going to GPs, clinical diagnosis made, the numbers may be as high as 2,500 a year. In America, they used to downplay the diagnosis of Lyme disease. Similarly, it was not reportable. And they said maybe annually there's 30,000 cases a year. A few years ago, there was an unfortunate incident when one of the senators in America, or one of the politicians, I think from North Carolina, a lady called Kay Hayden, was bitten by a tick and developed a central nervous system disease from a tick bite, and the actual infection was Powassan virus, and this caused severe neurological disease. She had to retire, and 2 years later she died. Following that, the U.S. Congress enacted the Kay Hayden Tick Act and appointed each of the states to start doing a better job of collecting data, gave them 10 million annually to each of the states to start recording that data. And the CDC now has miraculously estimated the number of tick-borne infections in America from 30,000 to 400,000. The European Union, used to say that tick-borne infections were rare. The European Union Congress have basically now come up with a position paper, I think dating back to 2018, 2019, saying there's probably 850,000 cases of Lyme and tick-borne infections within the European Union. Data from England, and I think there's data also from Wales and Scotland, has basically said that Lyme is rare, and they use very strict criteria to make the diagnosis just based on antibody tests that are in the laboratory. They don't include false positives, false negatives, a very, very selective case selection. So maybe there are 1,000 cases in England annually, according to Public Health England. However, a study that was done from the British Medical Journal Open in 2019 by Cairns et al., they actually did a review of something in the range of 8,000 GP practices looking at the records where the GP had diagnosed clinical Lyme. As I said, not based on the antibody, but the combination of antibody or clinical Lyme where patients were treated. And so all of a sudden, the estimates within the UK went from 2,000 annually, Scotland, England, and Wales, up to something in the range of 8,000 annually. So the reporting is just the tip of the iceberg. The number of cases of Lyme disease is possibly 4 times the number that had been reported previously. Following this report, interestingly, a number of UK microbiologists convened a meeting to say this was a bad study. And I'm not an epidemiologist and a modeler myself, but I wouldn't actually criticize the information. I think we are seeing in front of our eyes as clinicians more cases of tick-borne infections than the epidemiologists and public health doctors are keeping track of, and I think Lyme is much more common than we are aware. But overall, there has been a significant rise in tick-borne infections, even laboratory confirmed, between 2013 and 2016. Much more common in rural areas, significant clusters in southern England, and then even in hospital data, there are an increased number of cases of Lyme disease being reported. However, Lyme, I would say, is a great imitator, and there seems to be a reluctance, I think, on the part of many clinicians to even consider Lyme disease in patients who have already been given an alternative diagnosis with Lyme not even being considered. So there is a consideration that some cases of other medical conditions, fibromyalgia, ME, certain neurological disorders, certain psychiatric disorders could actually be Lyme disease. However, this at the present time, since we have inadequate testing, it's very difficult to truly estimate the number of cases of Lyme. But I think Lyme is on the increase. Tick-borne infections are on the increase. Climate change is affecting that. Land management is changing that. Changing in biodiversity. Changes in the way humans interact with nature. The One Health approach. Animals, humans. There's closer contact as we go along, and people are traveling. So people are traveling and bringing back more than they bargained for, and people are going in their backyards and sometimes getting bites unknowingly that could be Lyme disease.